On this day 5 years ago, March 5th, 2020, Colorado logged its first case of COVID-19. An out-of-state man in his 30s visiting Summit County Ski Resort. Now, we were still weeks away from howling out our windows at 7 o'clock each night in support of healthcare workers. Remember that? And a year or so out from those mass drive-in vaccine clinics. Well, Dr. Michelle Barron, Senior Medical Director of Infection Prevention with UC Health, was on Denver 7 regularly during those dark days. And today she and I talked about those times, what we have learned, and what her concerns are today. What did we learn as far as how to be better prepared, and are we better prepared today because of that?
Yeah, so I think we learned a lot of things in terms of how well we can cooperate with each other when we need to. And I think that was huge. I think the state of Colorado actually fared really well because I think there was that spirit of cooperation.
Where is your personal concern level about bird flu right now?
I think it's something we definitely have to keep an eye on. It doesn't keep me up at night, but it definitely concerns me at the amount that we're seeing and how widespread it seems to be impacting different types of animals. And the only reason that worries me is because that means that they can come into contact with humans more easily. Probably what keeps me up at night is actually measles. Measles worries me a lot, only because one of the downsides of the pandemic is that there's a lot more skepticism about vaccines. So mostly, I think, related to the COVID vaccine because it was developed so fast and there was just all this stuff coming out, a lot of it misinformation, but I think that lingers where now there is an increased level of skepticism about all vaccines, even some that have been around for 50 plus years and are very effective.
Dr. Michelle Barron, I'm so glad you're with us through COVID, and I'm so glad you're still with us today. Dr. Michelle Barron there.